We are all experiencing an unprecedented time in our lives right now. The level of uncertainty, anxiety, and fear can be overpowering as we learn to navigate in our new world, all doing our part, whether it be social distancing, staying home, and abiding by federal guidelines. There are so many on the front lines who are battling a war against an invisible enemy. Being on the front lines can place a person's physical and mental health in jeopardy. A team of professionals has come together and created a program called Resilient Minds on the Front Lines to bring tools, knowledge, skills, and instruction to assist in a time of need. This team is dedicated to helping those who help others. On today's webcast, our guest speaker is Renee White, Assistant Prosecutor for the Ocean County, New Jersey Prosecutor's Office, Board-Certified Family and Psychiatric Nurse Practitioner, and Master Resiliency Instructor. Renee discusses the importance that sleep has on our health and how it improves both our physical and mental resiliency. Your hosts for today's webcasts are Master Resiliency Instructor Michael Pellegrino and Dr. Kate Tumulty-Felice, Professor of Education and Psychology and Coordinator of Education Programs.
Resilient Minds on the Front Lines was created to bring you 15 minutes of hope in a world turned upside down. The topics in our webcast are all meant to help those on the front lines help themselves and others. Today, Renee White focuses on something extremely important in our overall health and well-being. That's sleep. Sleep is part of physical resiliency. Creating a good sleeping routine and atmosphere matters when it comes to our overall mental and physical health, and also resiliency. Doing simple things like creating a bedtime ritual, cutting out caffeine and electronic devices close to bedtime can help us achieve a good night's sleep. Be safe, be healthy, be resilient.
Hello everybody. I'm Assistant Prosecutor Renee White with the Ocean County Prosecutor's Office. I'm also a double board certified family and psychiatric nurse practitioner. I'm a Master Resiliency Instructor, and today I'm here to talk to you about sleep, part of physical resiliency. About 40% of our health is based upon our behaviors, the personal choices that we make every day, including diet, exercise, and sleep. The other 60% is based upon things we can't have a lot of control over, like genetics, medical care, and our environmental exposures. But we need to concentrate on the things we can control instead of the things we can't control. Aristotle said, "We are what we repeatedly do." Excellence, then, is not an act but a habit. If we want to improve our physical resilience, we need to look at our habits, like our sleeping habits, and change them in a way that we can get us healthier and happier. The small lifestyle changes we make over time accumulate to make big changes in our overall physical, mental, spiritual, and social health. We need to create habits that lead to good health, and that starts with sleep. Part of that 40% we can change by the choices that we make. So how do we do that? What can we do about it? We have to talk about our sleep needs. First, we need to look at the big picture. We need to acknowledge that sleep varies depending upon your age, your lifestyle, and your overall health. I can't give you an exact number of how much you need to sleep every night because we're all different. So instead of an exact number of hours, we're actually talking about a healthy range of hours instead. So opposed to me saying you need exactly 8 hours of sleep every night, what would be more appropriate is to say that most working adults require about 7 to 9 hours of sleep each day. Second, we need to do a self-assessment of our own sleep habits. Ask yourself, how much sleep do I need? So questions you need to ask yourself include, are you a shift worker? Are you fully operational on 7 hours of sleep, or are you nasty or cranky? Does it take you 9 hours of sleep to function well and not become sleepy during your day? Do you always feel tired while you're driving? Do you need a nap during the day? Are you waking up in the middle of the night? Or do you have trouble going to sleep or staying asleep, or both? Do you snore? We all have different personal needs when it comes to sleep. It's important to know how you feel on different amounts of sleep to know the number of hours that works for you. One of the best ways to do a self-assessment for sleep, I find, is to keep a sleep journal or sleep diary. Now, some people choose this old school way of using like a little notebook or paper chart, and other people like to track their sleep habits on a Fitbit or an Apple Watch or some kind of app on their cell phone. Whichever way you choose to keep track of how many hours a day you sleep, and your energy level and mood throughout the day, make sure you track your sleep for at least a week or two to pick up on any trends or patterns. Now, the third thing we need to do is talk about sleep hygiene. We need to do something that creates a good sleep atmosphere. We need to make sleep a priority. We have to commit to the idea that sleep is vital to our body's recovery from illness and everyday wear and tear. It's important to stick to a sleep schedule, even on the weekends. Listen to your body, and when you start to yawn and nod off, go to bed instead of binge watching Netflix for another 2 hours. Make sure your pillows, mattress, and bed frame are giving you a comfortable night's sleep. You'd be surprised what a new pillow or mattress could do for your sleep challenges. Don't do work or eat in bed. You need to associate your bed or bedroom for sleep activities, not work. You have to also be aware of sleep killers, like caffeine and alcohol, especially within 6 hours of bedtime. If you need tea or coffee before bed, slowly switch to decaf. Turn your alarm clock away from you, as clock watching is also a sleep killer. You need to stay away from the electronics before bed, even if it means setting an alarm on your phone telling you, put that thing down and put it on the charger and walk away. You should make sure your bedroom is also a good sleep temperature and that the light and sound are accommodating for your type of sleep. You should always exercise daily, but try to keep it at least 3 hours away from your bedtime. Practice a relaxing bedtime ritual. It doesn't have to be a bedtime story like we do for our kids, but some individuals find that reading a book, meditating, or even taking a warm bath can help them sleep. I also want to talk to you about issues specific to shift workers, especially those of you on the front lines of this crisis right now. If you know you're going to be sleep deprived for a while because of shift work, try to bank some sleep in advance. Think of it as depositing checks into your sleep bank for when you need to use that sleep money during the week or over the weekend. You can sleep before a midnight shift to negate the effects of staying up all night. And if you're going to nap and not sleep before a shift, make sure you limit sleep to about 30 to 45 minutes so that deep sleep, REM or REM, is not entered to avoid that sleep inertia or nap hangover. Longer naps could be beneficial, so if you have at least 2 hours, it will allow for one full cycle of sleep. Beware of taking sleep aids or other medications to promote sleep. These medications could cause grogginess or a sleep hangover and may make you feel impaired in the performance of your duties at work, or you won't even notice that you're impaired. Always read all package or pharmacy information about any medication you take, and always make sure to talk to your primary care provider about any medications you take, even if it's over the counter. And make sure you know how medications affect you before you go out to decide to go out and work on the road or go to work. Don't be afraid to talk to your supervisor and or professional associations. If you're having a particularly hard time working shift work or night shifts, talk to your supervisor about any adjustments that may be able to be made to promote your safety and well-being. I've been working in healthcare on and off for about 23 years. Many of those years spent doing shift work, particularly weekend midnights. Whether it's a 12, an 8, or a 16-hour shift, it's easy to become tired after a long and difficult night at work. It's important now more than ever before to be mindful of your body's sleep requirements and to make sure you're not working or driving impaired. According to a study by Dawson and Reed, reaction time is slowed to that of a legally intoxicated person after being awake for 15 hours. In general terms, reaction time and coordination get progressively worse the longer we're awake. So whether it's pulling your gun, hitting the brakes, starting an IV, giving medications, or being behind the wheel making long distances to make deliveries, or just being situationally aware, our performance is generally based upon the amount of sleep we've had or hadn't. I know it's easy to say and harder to do. I've been there, driving home after my third 12-hour shift in a row, when I couldn't eat, I couldn't even go to the bathroom during my shift, when my kids were screaming when I got home, or a lawnmower or construction kept me from sleeping between shifts during the day. I've been in the car at 7:20 in the morning with all my windows down, even if it was 32 degrees or snowing out, with music blasting to keep me awake. And unfortunately, I've heard rumble strips when I just blinked out. just for a second, and drifted to the side of the road. And luckily, I'm still here today, and my 4 kids still have a mom. Please think about the dangerousness of working and driving tired. As a former emergency room staff nurse, I have to tell you it can end your life or result in serious or permanent injury. And as a current assistant prosecutor, I have to tell you that if you get into an accident where someone gets injured or dies, and we can show that you were driving tired, we can charge you with a second-degree offense that carries with it a presumption of state prison time. And if that isn't enough to scare you into making sleep a priority, please take into consideration what living tired does to your family, even if you don't care what it does to you. The rates of divorce for first responders is through the roof. And when you are sleep deprived, your ability to manage your temper and emotions when talking to your spouse, your child, or significant other is really impaired. I've snapped at my kids, I've screamed at my spouse, I've spontaneously cried because I was so sleep deprived, and inevitably, I'm sure it's affected my relationships with my coworkers back in the day. Please think of sleep as something that's as important as your significant other, and it's important as your children. Sleep is precious, just like they are. Make sleep a priority, just like you should make your spouse, your significant other, or your child your priority. What it comes down to is if you don't get control over your sleep or lack thereof, it's going to control you. It will negatively impact your health, your job, and your relationships. But if you develop proper sleep habits and sleep hygiene, you're going to improve your mood. You're going to improve your energy and your health. Getting rest and allowing your body to recover is going to help you be the best person you can be. Please contact a sleep professional or your primary care provider if you have persistent problems with sleeping to determine if there's an underlying cause of your sleep difficulties or if you need a sleep study. Medication should be a last resort, not a first resort, especially if you have a job that requires you to be armed, requires you to drive long distances, or if you're dealing with critical care patients. For more information on sleep, contact the National Sleep Foundation at sleepfoundation.org. Thank you for everything you do. I'm Renee White. Be safe, be well rested, and be resilient.
Hi, I'm Dr. Kate Tumulty-Felice. I want to take a moment to thank Renee White for sharing with us her insight and expertise regarding the importance of sleep in our overall physical resilience and well-being. Renee's background and unique combination of experiences allows her to illuminate not only the importance of sleep and restoring oneself, but also tips and practical takeaways to help us mitigate some of the bad habits and build better habits to sleep so that we can take better care of ourselves and better care of the people around us. Sleep is such an important part of self-care. And sometimes when we're helpers, we worry about ourself last. And Renee speaks of that beautifully with all of our competing responsibilities. Taking that self-care and developing better habits helps us to be more effective in all different facets of our life. And it improves our overall physiological well-being. She gave us some great practical tips and takeaways to help make sleep a priority. Things like taking into consideration when you sleep and adverse conditions to sleep, such as shift work, and how we can mitigate and work with some of those challenges by banking our sleep, by napping more effectively, and really thinking about how we nap and what will that do to us overall, so that we can think critically about things like sleep deprivation, reaction time, sleep aids, and the effect that it might have on us cumulatively, and replace some of our less effective habits with more effective habits. Something as simple as where you place your alarm clock or the room in which you sleep. When we do these things, we start to develop habits of self-care. And self-care is so critical in our overall physiological well-being, but also in establishing better habits and better support of our own, prioritizing our own resilience. I appreciate that Renee gave us so many practical takeaways that we could use to prioritize ourselves. As hard as it is sometimes to put ourselves first, when we sleep well, we deal better with the world around us. So we're mentally healthy, emotionally more healthy, physically more healthy, and better able not only to help ourselves, but to help others. And that's really our goal here, helping you find ways to help yourself, help those around you, and do so from a more rested and restorative place. Thank you, Renee, for sharing that. And thank you for taking the time to think about that. I hope that you are better rested and that helps you handle some of the challenges you face. Be safe, be well rested, be strong, be resilient. Thank you.
During the COVID-19 pandemic crisis, your mental health is vital. Please see the resources listed here as well as on our website at onthefrontlines.us. You are not alone.